So let's proceed with number 155. 155. So, a thiazide diuretic can enhance action of amphetamine. So, thiazide diuretic plus amphetamine will result to an enhanced action. So, thiazide plus amphetamine, thiazide diuretics plus amphetamine will enhance the action of amphetamine. 156. Surfactants are characterized by the presence of water solubilizing and fat solubilizing groups in the same molecule. So these are substances that absorb to surfaces or interact to reduce surface or interfacial tension. So your surfactants may be used as wetting agents, detergents, or emulsifying agents. So I repeat, your surfactants may be used as wetting agents, detergents, or emulsifying agents. This is due to the presence of water solubilizing and fat solubilizing groups in the same molecule. Number 157, piperazine citrate or antipar, gentian violet, pyridinium pamoate povan, and thiabendazole, mintazole are all anthelmintics. So, piperazine citrate, gentian violet, pyridinium pamoate, and thiabendazole are all anthelmintics. 158. AZT or azithromycin is used in the treatment of HIV or AIDS. So your AZT or your azithromycin is also known as your cydovodine. So cydovodine or azithromycin or AZT is active against retroviruses, responsible for AIDS and certain types of leukemias, and for HIV infections. So your AZT or your azithromycin is also known as your cydovodine. 159. It is a folate reductase inhibitor, that is trimethoprim. So trimethoprim is a folate reductase inhibitor. 160. The structure of this class of antibiotic has a beta-lactam ring and a thiazolidine ring. So, letter B. So, your penicillin contains a beta-lactam thiazolidine structure. So, penicillin, meron siyang beta-lactam ring plus thiazolidine ring. And again, your cephalosporins has the same beta-lactam ring with your penicillin. 161. The generic name of Duracef is cefadroxil. Duracef, cefadroxil. 162. The preparation is used as pediculicide. Pediculicide, that is your Quell lotion. Quell lotion. So, your Quell or your Lindane ang generic name ng Quell, is employed locally as a cream lotion or shampoo for the treatment of scabies and pediculosis. So, pediculicides are compound effective in the treatment of infection caused by 3 species of sucking lice known as your Pediculus humanus, capitis, or the head louse, your Pediculus humanus corporis, your body louse, and the Therius pubis, or the crab louse. Okay. 163. The antibiotic that is obtained from Streptomyces norsei is your nystatin. Nystatin. Streptomyces norsei is your nystatin. 164. The plant containing the anti-cancer drug vincristine and vinblastine is your letter B, periwinkle. So, your periwinkle is an alkaloid which contains your vincristine and vinblastine, effective as an anti-cancer, which is obtained from Catharanthus roseus. So, scientific name for your periwinkle is your Catharanthus roseus. A very common adverse reaction of alkylating agents used in the treatment of cancer is alopecia, or that is your hair loss. So, that is one adverse reaction of your alkylating agents used in the treatment of cancer. So, that is the most common adverse reaction. 166. These are calcium channel blockers except your atenolol. So, your atenolol is a beta blocker. So, your verapamil, nifedipine, and your diltiazem are calcium channel blockers. Your atenolol is a beta blocker. The generic name of the brand Diabetes. So, the generic name of the brand Diabetes is chlorpropamide. Chlorpropamide, generic name of Diabetes. 168. A loop or high ceiling diuretic is your furosemide. So, furosemide is a loop or high ceiling diuretic that acts on the ascending loop of Henle. So, 169, this drug is used as an osmotic diuretic, that is your mannitol. So, mannitol is used as an osmotic diuretic. They are the mainstay of treatment for patients with increased intracranial pressure or acute renal failure due to shock, drug toxicities, and trauma. So, it is not absorbed when given orally, so it has to be administered intravenously. So, let's repeat. Mannitol is used as an osmotic diuretic for patients with increased intracranial pressure, acute renal failure due to shock, drug toxicities, and trauma. And because it is not absorbed when given orally, it is administered intravenously. 170. These drugs are narcotic analgesics except your mefenamic acid. So, your morphine, your codeine, and your nalbuphine are narcotic analgesics. 171. This is used as an inhalation anesthetic, that is your halothane. So, halothane is a prototype to which newer inhalation anesthetics are compared. So, halothane is a potent anesthetic. However, it is a weak analgesic. So, halothane is a potent anesthetic, but it is relatively weak analgesic. 172. Levodopa is used in the treatment of Parkinson's disease. So, levodopa is used in the treatment of Parkinson's disease. 174. Methenamine is also called as urotropin, letter D. So, methenamine is also called as urotropin. And this is toxic to most bacteria. However, it must decompose at an acidic pH of 5.5 of less than in the urine, producing formaldehyde. And this formaldehyde is the one causing toxic to most bacteria. So, your methenamine must first decompose at an acidic pH of 5.5 less than that of the urine, producing your formaldehyde, and this formaldehyde is the one toxic to most bacteria. Okay, 175. Neurotoxicity caused by isoniazid can be treated with pyridoxine. So, neurotoxicity caused by isoniazid can be treated with pyridoxine. 176. A broad-spectrum anthelmintic that is effective against a variety of nematode infestation and is the generic name of your anthrax is your mebendazole. So, it is a broad-spectrum anthelmintic effective against nematode infestation, which includes your whipworm, your pinworm, your roundworm, and your hookworm. 177. A common agent in smoking cessation programs providing patches is your nicotine. So, the transdermal patch and chewing gum containing nicotine have been shown to reduce nicotine withdrawal symptoms and to help smokers stop smoking. So, the withdrawal symptoms of nicotine addiction is characterized by irritability, anxiety, restlessness, and difficulty in concentration, and headaches and insomnia. So, nagkakos din ang nicotine ng physical dependence. So, the withdrawal symptoms are characterized by irritability, anxiety, restlessness, difficulty in concentrating, headaches, and insomnia. So, the transdermal patch and chewing gum, which contains nicotine, have been shown to reduce nicotine withdrawal symptoms and to help smokers stop smoking. So, 178, thiabendazole or your mintazole, a benzimidazole derivative, is an anthelmintic drug used primarily to treat strongyloides. So, yung thiabendazole is the drug of choice for the treatment of strongyloides infection. 179. One of the reasons why aminoglycosides are frequently combined with other antibiotics in treating certain infections is to prevent drug emergence of resistant bacteria. So, to prevent drug emergence of resistant bacteria. So, your aminoglycosides are combined with other antibiotics to prevent resistance bacteria. 180. Angiotensin converting enzymes or your ACE inhibitors are associated with a high incidence of which of the following adverse reaction? That is your proteinuria. So, your common adverse effects of ACE inhibitors are dry cough, rashes, fever, altered taste, hypotension, hyperkalemia, and proteinuria. Let's repeat. The common adverse effects of your ACE inhibitors are dry cough, rashes, fever, altered taste, hypotension, hyperkalemia, and proteinuria. 181. Which of the following chemotherapeutic agents has good penetrability into the cerebrospinal fluid? That is your chloramphenicol. So, chloramphenicol is completely absorbed via oral route because of its high lipophilic nature and widely distributed throughout the body. So, it readily enters your CSF or your cerebrospinal fluid. Okay, 182. The scientist who can lay claim to the title of father of chemotherapy is Paul Ehrlich. So, the father of chemotherapy is Paul Ehrlich. So, he developed the concept of chemotherapy. 183. Effective administration routes of nitroglycerin for angina pectoris include all the following except oral administration. So, IV, transdermal, and sublingual are the effective administration of your nitroglycerin. So, when nitroglycerin is administered orally, it will cause first pass metabolism and it will immediately be excreted. Okay, so it is common to give the drug either sublingually, intravenously, or via transdermal patch. 184. This group is responsible for the bone marrow toxicity of chloramphenicol, that is your nitro group. So, nitro group is responsible for the bone marrow toxicity of chloramphenicol. 185. Diazepam is used in the treatment of all of the following except your analgesia. So, diazepam is used in the treatment of anxiety, status epilepticus, skeletal muscle spasms, and preoperative sedation. Okay. 186. Which is not true regarding ceftriaxone? It is resistant to acid. So, ceftriaxone is not resistant to acid. So, ceftriaxone is a third-generation cephalosporin resistant to beta-lactamase and is administered parenterally once daily dosing. 187. All of the following substances are present in opium except methadone. So, your thebaine, your codeine, your morphine, and papaverine are substances present in opium. Okay. 188. An antipyretic aniline derivative with weak anti-inflammatory activity is your acetaminophen or your paracetamol. So, your paracetamol is primarily used as an analgesic and as an antipyretic. And it only has a weak activity as an anti-inflammatory agent. 189. The most potent of the inhalation anesthetic agents is your methoxyflurane. So, methoxyflurane is the most potent inhalation anesthetic because of its high solubility in lipid. 190. And also, your methoxy is the agent of choice for anesthetic of choice for pregnant women in labor. 190. Which of the following anti-neoplastics is not considered an anti-metabolite? Is your etoposide. So, anti-metabolites used in cancer therapy are methotrexate, mercaptopurine, thioguanine, fluorouracil, cytarabine, and fludarabine. So, the exception here is your etoposide. 191. Which of the following statement is not true regarding the aminoglycoside antibiotics? They are easily absorbed after oral administration. So, your aminoglycoside antibiotics are not easily absorbed after oral administration. So, they are highly ionized in solution, highly polar, polycationic structure, and it prevents adequate absorption after oral administration. Therefore, all aminoglycosides except neomycin must be given parenterally to achieve adequate serum levels. So, the only exception here is your neomycin. So, your neomycin can be administered orally, and the rest must be given parenterally to achieve adequate serum levels. Okay. 192. Baclofen are derivatives of GABA and is used in spasticity in patients with multiple sclerosis. It depresses monosynaptic and polysynaptic transmission. So, the mechanism of action of baclofen as in the treatment of multiple sclerosis is the depression of monosynaptic and polysynaptic transmission. 193. Long-term use of tetracyclines in pregnant women should be avoided due to several reasons. And which of this is not true? That is, they are toxic to the fetus and may cause absorption. So, the statement is not true. Letter C. 194. All of the following antibiotics produce neuromuscular blockade except your ampicillin. So, neuromuscular paralysis results after direct intraperitoneal or intrapleural application of large doses of aminoglycosides. So, your kanamycin, streptomycin, neomycin, and amikacin are antibiotics producing neuromuscular blockade, except your ampicillin. 195. For the treatment of systemic mycosis, which of the following antifungal agents can be administered by intravenous route is your amphotericin B. So, amphotericin B is administered by intravenous infusion, and the intrathecal route is sometimes chosen for the treatment of meningitis caused by fungi that are sensitive to amphotericin B. So, there are two administration, via intravenous infusion and via intrathecal route. 196. Which of the following agents is not used for local candidiasis? Is your griseofulvin. So, griseofulvin is principally fungistatic. It is effectively for dermophytes only. Dermophytes only, such as your trichophyton, microsporum, and epidermophyton. The rest, such as nystatin, gentian violet, miconazole, and clotrimazole are agents used for local candidiasis. 197. All of the following are effectively and clinically useful against worm infestation caused by Ascaris lumbricoides except niridazole. So, piperazine, pyrantel, pamoate, mebendazole, and thiabendazole are effective against worm infestation caused by Ascaris lumbricoides. Your niridazole here is an anti-schistosomal whose principal application is in the treatment of infection caused by schistosoma hematobium, or the one causing urinary schistosomiasis. 198. A good local anesthetic should have all the following properties except onset of anesthesia should be gradual and short duration of action to avoid toxicity. So that is the only exception of a good local anesthetic. So an ideal local anesthetic should have a rapid onset of action and a short duration of action. So, the action must last long enough to allow time for the contemplated surgery, yet not so long as to entail an extended period of recovery. 199. From the list given below, identify the drug possessing triad of features, which includes anti-amoebic, anti-giardiasis, and anti-trichomonal. Is your chloroquine, metronidazole pala. So, mebendazole. Metronidazole. That is metronidazole. Yes, so your metronidazole are the drug of choice for the treatment of, again, amoebiasis, giardiasis, and trichomoniasis. Number 200. Heparin is an extract of animal tissue. So, it is extracted for commercial use from porcine intestine or bovine lung. So, pig intestine and the lung of a cow. 201. Amongst the following, the drug of choice for acute attack of Plasmodium vivax malaria is your chloroquine. So, drug of choice for acute attack of Plasmodium vivax is chloroquine. 202. Drugs which act on erythrocytic cycle of malarial parasite will be effective for suppressive prophylaxis. So, it will be effective for suppressive prophylaxis. 203. All statements regarding antipyretic analgesics are false, except it raised the pain threshold. So, antipyretic analgesics raise the pain threshold. 204. The drug of choice for ringworm infection is your Griseo fulvin. So it is recommended for the systemic treatment of refractory ringworm infection of body, nails, hairs, and feet. Your tinea corpus, tinea capitis, and tinea pedis, caused by various species of dermatophytic fungi, which includes your trichophyton, microsporum, and epidermophyton. So, you only have to remember here that Grasea fulvin is the drug of choice of ringworm infection. 205. Acetaminophen is preferred over aspirin in following conditions except in rheumatic disease. So, acetaminophen has analgesic and antipyretic activities. Aspirin is used as an antipyretic, analgesic, and anti-rheumatic. Its use in the rheumatism has been reviewed and said to be the drug of choice. So, your aspirin is the drug of choice for rheumatic disease. 206. Oral neomycin and streptomycin are used for sterilization of bowel and for dysentery because they are least absorbed from oral route. So, the highly polar polycationic structure of aminoglycosides prevent absorption after oral administration. So, oral neomycin and streptomycin are used for sterilization of bowel and for dysentery because they are absorbed from oral route. Okay? 207. Which of the following is the most appropriate statement about indomethacin? So, it is a powerful analgesic and anti-inflammatory agent with antipyretic and uricosuric action. So, indomethacin is a potent anti-inflammatory agent and is beneficial in the control of pain associated with uveitis and post-operative ophthalmic procedures. So that is, and as an antipyretic for Hodgkin disease when the fever is refractory to other agents. 208. Which of the following is a depot penicillin preparation? So, that is your benzathine penicillin. Your benzathine penicillin is a depot penicillin preparation. It is very insoluble in water and it requires 3,000 ml to dissolve 1 gram, and this property gives the compound great stability and prolonged duration of effect. 209. All of the following drugs interfere with platelet activity except your dimercaprol. Dimercaprol is also known as your British anti-leucine or BAL. It is effective topically and systematically as an antidote for poisoning caused by arsenic, antimony, mercury, gold, and lead. And the mechanism of action is chelation with the metal. Okay. So, your dimercaprol or your British anti-leucine is the drug of choice for the treatment of poisoning of arsenic, antimony, mercury, gold, and lead. And also, it does not affect platelet activity. 210. 6-amino penicillinic acid is the common nucleus of all penicillins. So 6-amino penicillanic acid is the common nucleus of all penicillins. 211, diphenolate, an effective antidiarrheal drug, is related to your meperidine because they have the same structural analog. So, diphenolate and meperidine has the same structural analog. 212, Class 1 antiarrhythmic drugs result in decrease in heart rate of accelerated heart and usually reduce the rate of conduction of cardiac impulse. So they include the following except your amiodarone. So the exception here is amiodarone. Your class 1 antiarrhythmic drugs are also known as your sodium channel blockers. 213, by the way, your amiodarone belongs to class 3 or your potassium channel blockers. 213, which of the following drugs does not reduce blood cholesterol level is your epinephrine. So your epinephrine does not reduce blood cholesterol fiber. Your clofibrate, your cholestyramine and cholestyramine and dextrothyroxine are used to reduce blood cholesterol levels. 214, which of the following is the longest acting nitrate? That is your penta-erythritol tetranitrate. So your penta-erythritol tetranitrate relaxes smooth muscle of smaller vessels in the coronary vascular tree, and it is the longest acting nitrate. 215, which of the following is considered a primary drug for the treatment of all seizures except absence? That is your carbamazepine. So, carbamazepine is the primary drug for the treatment of all seizure types except absence. 216, which of the following penicillins is acid stable and therefore orally active is your cloxacillin. So, like oxacillin, cloxacillin is relatively resistant to acid hydrolysis, therefore may be administered orally with good effect. 217, a monoamine oxidase inhibitor or your MAOI is used as an antidepressant drug, that is your tranylcypromine. Tranylcypromine is a monoamine oxidase inhibitor. Your amitriptyline is a tricyclic antidepressant. Your thioridazine is a phenothiazine and is also used as a neuroleptic drug. Your clozapine is a dibenzodiazepine, and your fluoxetine is a selective serotonin reuptake inhibitors. So your tranylcypromine, amitriptyline, and your fluoxetine are antidepressant drugs. Your thioridazine and clozapine are neuroleptic drugs. 218, which of the following is not used for topical application on external surfaces? That is your sulfacetamide. So sulfacetamide sodium is especially suited as a solution for the local management of ophthalmic infections susceptible to sulfonamide therapy. So that is your sulfasalazole. 219. All of the following benzodiazepines are commonly used in the treatment of anxiety except your clonazepam. So your clonazepam is mainly used in the treatment of epilepsy. Your clonazepam is used in the treatment of epilepsy. So the rest is used in the treatment of anxiety. 220. Which of the following chemotherapeutic agents is not bactericidal? That is your erythromycin because it is bacteriostatic. Generally, your macrolides or the family of erythromycins are bacteriostatic. However, at higher doses, they may be bactericidal. So your carbenicillin, your gentamicin, your cefuroxime, and your vancomycin are bactericidal.